Hello everyone, this is Dr. Chandrashekhar. I'm the Chief Neurosurgeon at Noble Hospital, Magarpatta, Pune. So today friends, we're going to talk about a condition which is called as trigeminal neuralgia. So this is one of the very debilitating condition in which the patient experiences severe nerve pain which is related to one of the nerves that supplies the face. So there are two types of nerve which comes to the face. One which sort of gives power to the muscles of your face, and the other nerve which carries the sensations from the face to the brain. So in neuralgia what happens that the nerves that carry the signals to the brain, as it reaches the brain, it gets irritated by a blood vessel which is closely attached to it, and because of that the patient experiences severe neuralgia. This condition is also called as a suicidal pain because in the days in which the treatment were not available, patients were driven to suicide because of the pain that they used to experience. The pain is classical for lasts for a few seconds. It comes as a lightning. It stays for a few seconds, say 10 to 15 seconds. It gets initiated by any movement of the face, like speaking, talking, like brushing your teeth, or putting water on your face, or wiping your face, or even opening your mouth to talk. So, all these impulses or all these movements they initiate the pain, and after which the patient has to hold his face and has to, take some medicines to alleviate the pain. Initially, the symptoms are very well treated with medical line of treatment. So there are certain medicines that the neurologists and the neurosurgeons prescribe to you based on which the pain subsides. However, unfortunately, in some cases, in spite of taking medicines, the patient is not completely relieved. In such cases, what we do is we advise the patient to undergo some imaging like MRI brain, following which the diagnosis of the condition is made and the further treatment options are discussed with them. The treatment options for neuralgia include number one, what we call as a radiofrequency ablation. So this is like an invasive procedure which is done on an OPD basis, in which, based on the CT scan or a C-arm machine, we localize the way the nerve, the situation, position of the nerve, and then with the help of a wire and a radio frequency waves, the pain fibers are, with the help of increasing the temperature, they are ablated, and the patient has got good pain relief for at least 2 to 3 years. In some patients, the pain relief lasts forever. The most definitive or the most certain or the most appropriate treatment, you can say, for young patients is what we call as a surgery, a microvascular decompression surgery, in which we approach the brain from behind your ear. We reach to the place where the blood vessel, and the nerve are in contact with each other, and then they are separated, and then we put an insulation between the two, and this sort of permanently stops your pain. So this treatment is recommended for young individuals who have a long life ahead of them, because all the medicines, taking prolonged medical therapy also has its own side effects. In very old patients in which the treatment is not possible, the new treatment method what is called as the radiosurgery, in which we give radiation waves which is given in a single shot and which is given to the nerve so as to alleviate the pain. So both the radio frequency ablation and the radiation, which we call as the radio surgery, both are ablative, means they damage the nerves. Whereas the surgery, in which the nerve is preserved and we separate the cause, that is the vessel, away from the nerve, and the patients have excellent results. So till now we have operated close to 40 to 45 patients of various age groups over the last 4 years who have got excellent post surgical and post treatment results from this painful condition. So, whenever you experience a pain on one side of the face, which is sort of aggravated or triggered by movements of the face, by brushing, eating, speaking, laughing, or putting water on your face, then you need to consult your doctor and need to take appropriate treatment for the same. For more information on this illness, please reach out to us at Noble Hospital, which is Pune's first and only JCI accredited hospital. Our team of neuroscientists, including neurologists and neurosurgeons, will ensure that the best treatment and the best advice is given to each and every one. Thank you.